I mean, as part of my work, I go to police stations almost every other day. And if someone asks me what is the difficult job between working with police and doctors, I would always say doctors. Police are always easy to work with for me. Doctors are extremely difficult to work. I'll tell why, but to you, what are the beliefs and opinions of medical practitioners, that they hold about bodies that are, let's say, unscientific, prejudicial, about persons of intersex variations? What are their beliefs and opinions?
Thank you, Tashi, for that question. Good morning, everyone. Audible, everyone? All right, thank you. So I'd like to start off by stating my positionality. I am an ally and I work with the government health system in Kerala. Now, so I would like to put off a very gentle, very mild trigger warning to any of our intersex friends who might be here with us today. So coming to Tashi's question, one major problem that I've observed among the professionals, the health professionals that I've interviewed, is that most of them did not know the differentiation between sex and gender. So here, intersex is actually a biological phenomenon, a biological presentation with diverse presentations and variations, with external genitalia or internal genitalia, gonads or chromosomal patterns differing in diverse ways. It's actually seen as a medical condition or a problem between among doctors, but it's actually a diversity which they are not able to digest as of now. As of now, because the medical curriculum doesn't have anything stating it comprehensively. Also, some of the people who do know about it, for example, endocrinologists or pediatric surgeons, still use pathologizing terms like disorders in sex development instead of more practical or more better words like differences in sex development. And also some of the specialists like the pediatric surgeons feel that since this is a biological presentation, it needs to be kept out of the spectrum of the LGBTQI+ community, not understanding that intersex people can also have different gender identities. There can be an intersex trans person, intersex non-binary person, or an intersex gender fluid person for that matter, with a spectrum of sexualities and gender expressions also. So, which they do not know, and for the same reason they do not understand that they need to be kept into the ambit of the LGBTQI+ community. A very sad fact that we found was that we interviewed a few gynecologists, some having even experience over 15 years or more in the government health system, and they didn't know the basic difference between sex and gender. So when we asked one of them, what do you feel is the difference between an intersex and a trans person, she actually went on to say that intersex is a term that is used to denote transgender people within India, and transgender is the word that is used to denote a trans person outside India. So I'm not blaming anyone. I'll be very soft when I talk here. I'm not blaming anyone, but this is the scenario. I'm just giving you a fact check of the current scenario among the health professionals that we have today. Also, in the mental health arena, it is still perceived as a psychiatric or the psychological phenomenon, not the biological aspect of it, but maybe the gender identity aspect and the sexual orientation aspect. There is still a deep-seated belief that, this is treatable or it is interchangeable according to the whims and fantasies of the medical practitioner. Yeah, and also they are the unique life stressors. The life stressors of the intersex people are not actually delved deeply into, which is also a big issue. All right, and another thing is regarding childhood surgeries. There's this very deep tension, between medical practices as well as the individual autonomy or consent of a person. So maybe some surgeries are life-saving or emergency ones that are done during infanthood or childhood, but then there are also other non-emergency surgeries which are called as normalization surgeries. But the problem with this is that the medical practitioner is actually going on to assign not only a sex but also a gender for the child. So, and what they say is that I'm saving the children from perpetual social exclusion and the families from ostracization or permanent condemnation from the society. So these are some of the beliefs that healthcare providers within our system hold currently, and which definitely needs to change, as you would have understood by now.
See, exactly that's what I meant. Doctors don't know but can't help be the experts all the time. Police can't and won't argue in a police station to be experts of the law. You can talk to them about law and tell them that you're wrong and show a book. But to doctors, it's next to impossible. And added to it, the complexity of the nature of divinity that they carry, in themselves all the time, right? Thank you for that, Manju. Shyam, over to you. As I think about this question, I'm thinking many years ago when in Telangana, the interaction between trans women, especially from the Hijra community, and trans men and trans masked persons has started. All a bunch of Hijra women, people who are working in the community, we were always like, look at us, we so much want to be women, and why does these people want to be, men? Why are they here? That was the reaction, first immediate reaction, right? And in a sense, there's still a lot of, unrecognition within, the community about trans masked persons. So how do you, through your study and your work, how do you look at the historical invisibilization of trans masked persons, in queer trans movements in India, in Kolkata? What is that like?
Yeah, so about the historical invisibilization of trans-masculine individuals, trans-feminine individuals have had a certain socio-religious narratives there, so some kind of conceivability through socio-religious narratives. Like in Bengal we have Hijra, then Koti. Koti is it's the identity in relation to sexual partners amongst gay men. So I'm using the word conceivability here, not representation, because that conceivability is on terms of society, how society finds it acceptable, not representation as in what the trans feminine individuals themselves feel. But there are no such traditional frameworks for trans masculine individuals. So that is one reason. Secondly, in the late 20th century, the 90s, there was a lot of visibility through the HIV/AIDS funding projects of the National AIDS Control Program, where penetrative sex between AMAB, that is assigned male at birth individuals, they were recognized as high-risk groups. So in that sense, the sexual relations between AFAB individuals was invisibilized. And there was no discourse on gender at that point as such. The word transgender came into the queer discourse much later. So, and then thirdly and very importantly, social norms have always associated masculinity with some kind of progression, while femininity has always been associated with regression. Like when a girl child wants to be a boy, you are going up the social ladder. And so trans-feminine people in some ways become even more stigmatized in some ways. And in my mother's PhD study, that was also a base for our study. So we found that among the trans-masculine narrative, 61% of the narratives involved acceptance and integration into family. And that was also possibly because of a desire for sons, which was there. And so acceptance and integration into family also means integration into society. And so trans-masculine individuals also try to blend into society as fast as possible, either through maybe integration into this family as the son, or by through marriage, or under the garb of this heteronormative domesticity, which kind of also validates their masculinity in relation to a woman. And fourthly, even when there is no such direct son preference also, masculinity is always considered to be the standard of life in many ways. Like when we say the word, what is unisex, like even if we go into a mall, the men's section is very standardized. I have observed it myself, it's very structured, standardized, there are not much variations. So the male norm is considered it's the standard of life, and as it is a norm, it does not need to be perfected, because norms are perfect essentially. But anything feminine thus has a special burden of being perfected. And in the PhD thesis that my mother wrote, one of our respondents who was trans-feminine, she said that they have to continue maintaining those external feminine attributes to gain that acceptance. And the list for masculinity is thus much smaller, those ways to get integrated, because the burden is much more on trans-feminine individuals. So, So that's the male norm is kind of disembodied and kind of unmarked in its ubiquity because it's everywhere. And femininity is marked as the exception to the norm. And so there's a lot of more burden on trans feminine individuals. And trans masculine individual experience is very important to the queer trans movement because the AFAB body has a history of oppression. And so that gives a new meaning to expressions and articulations of masculinity itself. Because our experiences, our histories have the potential to bring masculinity to scrutiny. Because feminism is always considered to be women's upliftment about women. And so masculinity at times just becomes this unquestioned norm of humanity. So critically engaging with masculinity and creating subversive masculinities, that is, I think, very important for us.
Thank you, Shyam. I think one thing to kind of always keep in mind, I think, with trans men and trans masc persons in that sense, both the hyper-visibilization and the invisibilization, both bring in violence of its own kind, I think. To forget that makes it dicey, I think. It brings in both different kinds of pressures and burdens, and continues to perpetrate that violence by the mainstream world, in terms of being visible and by terms and means of not being visible, I think. Now, moving on from violence, because we as queer people quite a bit talk about violence. We are not fans of it, but we are so in abundance of it, right? So we can't help but actually be so much thinking and talking and discussing about it. But the next paper, the next panelist we have, I've written something on trans joy, which is very, not so often discussed and written. Queer joy, trans joy. Any media house who calls any of you out there as a queer person, they are going to only ask you your sob stories, not anything else, right? So in terms of when you thought of this paper and wanted to talk about trans joy, and doing this work, what are the sources of trans joy? Like, especially when only everyone wants to hear our sob stories.
So, the intention with this paper was when I first started out researching for this on trans joy, I felt like this narrative of trans joy was something that what conversations were coming across within the community itself, right? But when I went back to the literature research, it was all focusing on, say, distress-based models or deficit-based models, which felt like it's not capturing the true holistic experience of what it is to being a trans person. So that was the intention of this paper. It more than just a research, it's about nudging people to bring another perspective, right, on trans joy from a positive psychology perspective, which is not to say that the distress-based models are not valid or that shouldn't, it should be replaced by the joy-based narratives. The idea is to look at trans experience as an integration of both of these sides, right? As trans lives can be difficult, but we need to understand, especially in the space of mental health, we need to understand the sources of joy. How does joy feel like as a trans person? All of those things, in order for counselors, mental health practitioners, or any sort of people working with this community to understand where and what are the sources of joy, how to tap into them. Because I remember this analogy Kray had given me, that it's an analogy from positive psychology, where if we have a garden with a lot of weeds, right? If we pull out all the weeds, we are still left with just a barren ground, right? We need to actively plant flowers, we need to actively plant plants and grow them. And that is only possible when we understand what it requires, what a flower requires to grow, what a plant requires to grow. So I love that analogy, and it has really stuck with me. So that was the intention. Coming to the question of sources of trans joy, I feel, I took a framework for the research. I took a framework and kind of understood the interviews, the perspectives of the participants from this framework, and there were certain key points that were highlighted which were similar to what international research has been saying on this topic. One was definitely community. It came across as one of the biggest sources of joy in trans people, right? I feel like we all here would know what community means to us, right? Community is a place for us to be who we are, for us to explore who we are and be away from that constant sense of hypervigilance or constant state of anxiety that we would be when we are out in the world among cis-normative people, right? So community and belonging came out as the primary source or a very important major source of joy. The second was gender performance. Now, gender performance and mastery of gender, these are words used across literature. I am not the biggest fan of these words, but what they mean is how do we distinct between the two is, I think more than the words, the meaning behind it is important. Is performance of gender is more about behavior, is more about what are the little things that you do to make you feel affirmative, that make you affirm your own identity, that give you a sense of euphoria. While mastery of gender is, I hate that term, but essentially there is no gender to master, first of all. So essentially what it means from a theoretical point of view is the kind of validation or the kind of joy we experience when others around us acknowledge us, validate us, and just normalize our existence, right? I think the locus is different between these two, and I completely agree with that. It's like when you yourself when you yourself do little things that make you feel validated, that acts in relation with how others are perceiving you, and that brings about a more nuanced emotion, I feel.
Thank you, Soochit. For the second round of it, going over to Manju, what were the experiences of intersex persons in your conversations with them that they shared about their engagement with healthcare institutions, educational institutions? What were their lived experiences like?
So basically in the aspect of educational systems, I'll start off with educational systems first. They explained that they didn't have enough role models, as in trained educators, teachers, psychologists, clinical practitioners at the school level to confide in. And there were instances where while other students in the class discussed about the 10th or 12th board exams or the other streams, next career options that they were going to consider, the intersex people would be usually thinking about what their gendered identity is, what their, whether they were a male or a female or any other, gender, or they were all constantly worrying about their sexual orientation at that point. And also in schools, we all know that we don't have neutral toilets anywhere. Schools, to dur ki baat hai. So they always had a lot of discomfort and also a lot of medical complaints regarding it with respect to it. And even if they thought of confiding in a friend about it, the word would usually spread around, and then there would be a lot of bullying or violence, or you understand, right? So that usually happens because kids are usually very curious, and this is also a concept that they've not heard about before. So this also causes a lot of huge educational breaks, when they study. Also, while in school, they were not really aware that they could take time to explore their gender identity as well as the sexual orientation without having to really settle into a binary norm just in order to fit in. And also, many of them told that, most of the families were entirely supportive of them, but then the parents were condemned constantly by the society, even by school teachers, for actually raising these children without abandoning them. So they are made to feel guilty for even having been born, which eventually leads to a lot of migration. And then there's also this intersectionality angle that comes in, where we interviewed a few intersex people who are also trans people and hail from Dalit communities, as well as had clinically diagnosed mental health conditions like bipolar disorder, which again leaves them way more vulnerable. Regarding health systems, the problem basically begins from the starting, as in from the premises, the security gates itself, from the security to the front desk staff, to the staff nurses, other health professionals, doctors, etc. So even at the front desk, there's a lot of misgendering that happens there. There's a lot of dead name calling and a lot of arguments also ensue from there. And there we have a form for the OP chits, where in the space where sex is written, there are only 3 options. One is male, the other is female, the other is transgender. So again, there is that mismatch and that lack of understanding, and these things haven't changed even now. I'm talking about Kerala, huh? Okay.
Thanks for the disclaimer.
All right. So, and the doctors also blatantly, refuse to treat, saying that I don't know how to treat you. Now, this is not for gender affirmative care. This is even for just regular ailments that we go for. Like even for a fever, the person goes and says that I have a fever, please help me out. And they says, I don't know how to treat an intersex person. So, this is the kind of response that they've received. And even with the specialists like the endocrinologists or the pediatric surgeons or the psychiatrists, they always tend to make them feel incomplete, and whenever they are on the examination table for a medical checkup, they are usually laid out naked, nude, and they call in a lot of people like house surgeons or other residents, medical residents, to study the body. So they feel like they are made to become like guinea pigs or like something to learn upon. And so visiting hospitals itself is like an additional trauma, fresh trauma for these people. And you might already know about infrastructure inequalities and inequities. I'm not going to talk much about that. Regarding surgeries, they feel that none of our doctors are competent enough to provide comprehensive gender affirmative care. Of course, private hospitals do it, but then there's a very high out-of-pocket expenditure that comes along with it. There's no follow-up care that's given, and usually there's a lot of post-operative complications that come along with it. There are a slew of corrective surgeries that follow it, often offered at exorbitant rates again. And they also feel that they are being experimented on the operating table, and they feel that even if any fatalities occur, there's no one to really look out for them. Regarding mental health, there's really a dire lack of queer affirmative mental health care practitioners, and they also raise their voice against infanticides, abortions, which is a breach of right to live again, and normalization surgeries that I just mentioned a while earlier, without the consent of the children.
In a sense, over to you, Shyam. Right now, I'm just thinking about back home, we have this free bus service for cis women and trans people. The circular says trans people. Often trans women don't get onto those buses for obvious reasons, of course. And when trans men try to get onto those buses and ask for the free ticket, it's like, why do you want a free ticket? And there's no way of recognizing them as trans, right? Completely unseen in that sense. So, I mean, in urban spaces, what is the ways and means that trans masculine persons find to become visible? What are the sources? And how do they see themselves in this entire invisibilization in an urban setup?
Our research was on the migration of transmasculine individuals from their hometowns, that was mainly in the rural and semi-urban districts of West Bengal, to Kolkata. So Kolkata was an important part of our research. And so a city like Kolkata, or any city for that matter, is characterized by the twin elements of one is anonymity and other is diversity. And often in the dominant, often in the dominant urban imaginary is kind of associated with loneliness and alienation, and that is contrasted with the community feelings, proximity of the dominant rural imaginary. So there is one concept that we came across while doing the work, the concept of intimate anonymity, which was given by Hillel Shokin. They were talking about an ethical approach to urban design. So intimate anonymity kind of bridges this gap between anonymity and diversity. It's based on the idea that a city is a place that allows human beings to form relationships with each other at various levels of intimacy while remaining completely anonymous. And so in terms of their they have multiple relations of interdependence with each other, where they play functional roles for each other. And as a result of this anonymous and transitory character of these relations of dependence, which is also very impersonal, they were also relatively freed from the burden of the personal and emotional controls of the tight-knit family and community relationships that were coming forward. There was a lot of proximity, and they had to bear that burden, which was part of their motivation to come to Kolkata. And so it brought them, ironically, this depersonalization with other relationships, it brought them closer to their own feelings of self. They thought of what I want or what I feel, feelings that had been totally suppressed. And so, and diversity, which is about the cultural, geographic and social and economic variety of practices and identities which are specific to urban spaces. So at least there is this, despite not always being realized in like empirically realistic terms, at least it provides for this ideal possibility of diversity. Because lived reality of city life involves constant interaction with the unfamiliar or the unknown. That is continuous navigation between ways of being, doing, meaning making between the self and the other, if we go by that binary. And so that also breaks that self-other binary, because there is this, at least this scope, this potential for this recognition of what real Phelan called unfamiliar familiarities, where the unfamiliar also becomes familiar in a socially diverse context. And that leads to the scope for various frames of reference. Like one of my respondents was, he was coming from, so he came to the temporary residence shelter that our queer-based organization SAFO provides for people who are rescued from natal family violence or domestic family violence and who migrate to Kolkata and don't have any shelter. So they are given that shelter, and his roommate was a transmasculine individual. At that time he still didn't have that language. So his roommate for the first time asked him the questions that how do you find comfort? What do you feel? And so those questions were very important to him. They made him realize what he was. And also two of my respondents, they talked about a different kind of masculinity, doing something different. Like I was talking about how it's easier for transmasculine individuals to kind of blend into this disembodied masculinity, but you have to remain normal, you have to remain average, you can't try to do anything more or anything different. And so then you will be totally shunned, ostracized. But they were talking about doing some kind of like different kind of masculinity. And so like Merleau-Ponty says that it is through expression that thought becomes our own, that already that acquired fortune of masculinity is there, but I'm also disrupting it, taking from it and creating new meanings. So there the self has total agency. And another thing that came out, that migration is not a linear teleological journey, that there is not one single perfect identity affirming environment that the urban space provides. There's a constant navigation with the urban space. And the urban space also puts on a lot of pressure to perform, that is that mastery of gender. So that kind of becomes this individual problem, that you have to justify your masculinity by getting the best, you have to succeed in performing that gender to the best of your ability. So this exclusive focus on this mastery, competence, autonomy, one of my frameworks was also the self-determination framework, which focuses on the three intrinsic psychological needs of competence, autonomy and relatedness. So too much focus on competence and autonomy can, just 1 minute, so it puts on a lot of pressure. And so in that case, the relatedness becomes very important. This journey from social exclusion, social ostracization to finding one's community, creating one's community, not just inclusion that someone else is including me, but we are equal stakeholders to the same community, that these collective spaces, like my organization that provides that collective consciousness. And so there's this transformative journey from a very controlling relatedness that also I think kind of gets disrupted.
Thank you for that, Shyam. So, Soochit, over to you. The unknown, often unrecognized component of queer lives, the joy. How does it make, possible ways of trans people to live their lives?
So through our interviews, we also like spoke to many trans non-binary people and just came to understand, like we talked about the mastery of gender earlier. So with respect to their gender expression, be it about clothes, hair, etc., all of these things matter a lot to trans people with respect to, because especially because these are ways in which other people around them are able to validate how they feel from inside. And for a lot of people who are especially stuck at homes or in a society where they can't really express themselves, like for instance, we came across this one trans feminine person who really could not be feminine outside. So whenever they would want to just feel okay, would quickly step into the washroom for 2-3 minutes, put on some lipstick, look in the mirror and feel just good about themselves, and then had to wipe it off, come outside and just live in the cis heteronormative world that this is, right? So just with respect to, as I said, hair, clothes, etc., all of these things are really affirming for a lot of people and provide a sense of hope for these individuals. Also looking at other trans people live their lives, just providing that sense of hope that maybe one day they would be able to be in a world where they can just be themselves and express themselves fully. Yeah.
So just to add to that, when we talk about possibilities, I feel that joy as an emotion has a lot of potential, has a lot of capacity, and in the sense that joy is something that is not just an emotion that's felt, but that's an emotion that's brings in a sort of energy, a sort of helps us move beyond what we are, imagine possibilities, imagine ways of living, ways of relating to each other, and just we talk about, so our research found out that joy has, in terms of joy, how joy has helped trans people live their more authentic lives. People have talked about how the initial experience of them coming out, or the kind of people they have been surrounded by, if that was good, so that brought about the joy which could then further help them explore their gender, be more creative with gender, just playing with it, being creative with it. And I feel that's what the true essence of queerness is, right? Queerness by definition is fluid, it doesn't have boundaries. And trans identities, yes, there are trans binary identities and trans non-binary identities and everything else. But the essence of queerness is that no matter who you are, you should be able to feel that you are able to live an authentic life, no matter what sort of where you fall on the gender spectrum or how do you look as. So joy has a very powerful potential to build this sort of an environment, to build what one of the researchers called and a notion of relationality, which is based strongly on an ethic of care.
Thank you, Soochit. Now you organizers want me to summarize violence, invisibility, and joy. And that's going to be sorry, not taking up that burden myself at all. So I'm thinking we'll rather do something slightly different in terms of, let's do a collective summarization. Let's do a collective contemplation, because we're talking about body and gender, and more or less, right? Everyone in this room has a body. Everyone does have a gender, presence or absence of gender, however you want to say it. Can we all take a moment, like bring ourselves, our bodies and minds to this space? Sit a bit straight, alert, not, if it helps you, close your eyes, We're talking about body, gender, sex as identities that we, inhabit, carry with us every moment of our life. So let's just do a quick scan through of our bodies. Where does, which part of body do you point out and say is your sex stays in? Is it your eyes, nose, your face, penis, vagina. Where does your sex stay in your body? And if you find a particular spot where you think your sex resides in, what happens if that body part is altered by a cause of illness, injury, something that you have no control about? Your age. What happens to your sex? Science says sex is determined by a bunch of things: hormones, secondary sexual characteristics, penis, vagina, reproductive organs. What was your sex when you did not have the sex hormones before your puberty? What does it mean to really look and find this notion and aspect that is so solid called sex in our body? Similarly with gender, where do you place gender in your body? From head to toe, which part of your body determines your gender? Or if it is not your body, if it is about what you wear, how you walk, how you dress, is that what determines your gender? So, if any of this changes, does it mean your gender also changes? Does it mean when I wear something in the day, my gender is so and so? When I change the dress before I sleep, my gender changes. So I wake up with one gender, I sleep with another gender. So where does gender and sex actually exist? Where is it that I can point out and say that this is my gender, this is my sex? So solid, so sure, so certain. Thank you. I want all of us to do this even before we ask questions, because it's important for us to think about, because the panel here or queer people alone are not, in a sense, responsible to answer and address about questions of gender and sex. The problem is that, queer people and trans people have been questioning and asking questions about gender and sex for a long time. The problem often is that no one wants to do it. And not because you're not gendered, you're not sexed. We all are sexed and gendered and affected by it in so many ways, but somehow it is always queer people, trans people who should answer about gender and sex. That's why, keeping that context in mind, I think probably, we open up to questions from the audience. Thank you.
First of all, thank you for the wonderful paper presentation. So I would like to know, what is the best possible approach that a therapist can take, when dealing with queer people or trans people, so that they feel more inclusive, because there are situations in where people, even after approaching a therapist, they don't feel more inclusive, or they still feel that the therapists are also in a way trying to judge them or make them feel that they are something different. So what is the best approach therapists or practitioners can take so that they feel more inclusive and they don't feel that we are not in a safe space when coming to a therapist to talk about the problems?
My question is for Dr. Manju. You know, one thing that comes up often is, do we really need to label people, you know, newborn, when people are born? Do we really need that, right? Can we wait for some time for them to understand and identify themselves, right? It's all about self-determination. But the other thing that comes up often in discussions with students and others that I have had a chance to sort of discuss in workshops and all is this whole idea of birth certificate, right? That we need that labeling because we need to put in there. And if I'm not mistaken, and correct me if I'm wrong, I think it's still binary, the birth certificate. So I'd like to know your thoughts on this, especially in the hospitals and in the medical science discourse. How does this play out?
About the LGBTQIA plus community, I think there's still LG, maybe B, the rest are sort of forgotten, right? So, so when it comes to intersex people, how does that play out? So we spoke about community, the importance of that as a source of joy. So that within the community, the acceptance or even just the understanding or awareness, how does that play out in their lives, and does that have an impact on their mental health as well?
Many of my students come out in the class. They say that it's a safe space, and with all the papers that are taught, they feel safe to come out. And the dilemma that I go across is how to sometimes differentiate between inclusivity and discrimination. So, because once they come out, of course, we would want them to feel more included in the classroom, but also there's this, you know, we know there's stigma, there's bullying, and there are other students who are still not aware of the queer community and their struggles. So I don't want it to be discriminatory. So there's, you know, how to strike that balance of providing support, but at the same time not making them feel that they're different. And again, with different, I do not mean to not include difference with inclusivity. It's just a little dilemma how to support the class or other students when some of the students come out and express their gender identities.
As a therapist in training, I catch myself doing that and send myself a little bit hate, a little bit of love because I did that. How do I stop myself from the otherization of something that I'm not really familiar with? Before learning about them, I want to be able to not see them as the other, but like upon same here types before I try to like go really intellectually learn about them. How do I stop that?
First, so the first one was about how can a therapist be more queer inclusive and make sure that they're providing the right support to their clients, right? So I think mostly also because a lot of times in the field there is more harm than support that is provided to queer clients with respect to conversion therapy and all of it happening. We've seen so many cases where the therapists or counselors that their clients try to fit into the cis heteronormative society to kind of ease the anxiety that they're feeling or to ease the discomfort. But that is not the aim, that is not what the client wants. So just going from, again, like a person-centered approach, trying to understand what they would like, and as a counselor having that understanding of the queer community of trans people especially, so to equip yourself with be it like queer affirmative, I think Mariwala itself has a queer affirmative counseling practice course, to be more trauma informed, because people coming from marginalized communities do tend to have certain backgrounds and all of that. Thirdly, to also make sure that you are reaching out, like it can be small things, right? Putting like a pride flag or a trans flag in a bio, using your pronouns in your email signature, just to make sure that other queer people, when they see you, they see your profile, they know that this could be a safe place and they can come and confide in you. So these are some basic things that a therapist can take. And again, yeah, as we did in the summarization process also, starting with asking questions about your own gender and sexuality, so as to not also otherize, as someone also asked, right? Gender and sex is assigned to everyone, and to start questioning those binaries, those gender norms for yourself will also help you understand more. Reading more literature online, there are loads of videos, articles, research papers online. talking to people with lived experiences. These are some things that a counselor can do to just to grow their understanding about the trans and queer community.
Yeah, so I would like to answer the last question. Correct me if I'm wrong, you were talking about how to stop otherization when we are not familiar with that person's, like, their experience. That I think that was your question. I feel letting that person speak. Like, often what happens is that queer people, like I have experienced this, we are not heard. So letting us speak, and then I think that will give you that knowledge, that understanding, if you listen and be open to something new. So that openness to something new, that everything does not have to be like me. My frame of reference is not the only frame of reference. There are multiple ways of, like, looking at life, living life. So that openness is very important, and letting that person speak, that is very important. And the question on, like, inclusion and discrimination, I was just thinking, like, often in discourses of inclusion, what happens is that I will include you, so that binary is often created. So I think where a space where we are all co-creators of that space and we are all stakeholders to that space, that really helps in kind of, you know, resolving this problem between inclusion and discrimination, if we can co-create a space together.
In response to Mritika's question, so the thing is that though intersex presentations are completely biological, the fact remains that they also have a gender identity and a sexual orientation. Much of it emerges at a much later point in time. Even the biological presentation, for that matter, may not always be present during infanthood. It might develop much later, during the adolescent age or the pubertal time. And so with the case of gender identity as well as orientation and the gender expression aspect also. So it takes time. And there's also one thing that I've noticed in common. The intersex people themselves, they do not have any narratives or role models to look up to, or they do not even know people like themselves. They are brought together by one or two activist intersex people who bring them together, and then they have their discussions, and they open up to each other and understand that, okay, we have other people also like us, and they themselves are not aware that they are allowed to have different sexual orientations and gender identities. So they are not accustomed to words like gender fluidity or agender. So that lack of language is also a huge issue, especially not just in English. Definitely we do have a few terms and terminologies, but then Malayalam, in our language, it gets even more limited. I think that's the case with every regional language for that matter. So that's where a lot of restrictions and a lot of limitations come in. We need to have more dialogue with the intersex people for that, and to also kind of try to understand what kind of terminologies that they are comfortable with in their own regional languages, and to also understand that there is a wide spectrum and that they are way more diverse than they think they are. And again, answering to ma'am's question, yes, ma'am. So currently we are having only binary, options on our birth certificates, even with no space for writing, with no column for adding the intersex option. So the thing is that, like you said, we need to actually give them time to explore themselves. And so the problem is that mostly infanthood, like childhood surgeries, a lot of infanthood surgeries are done without the child's consent, and we do not have a law to, we do not have a law to block that or go against that. Definitely in Tamil Nadu, the Madras High Court in 2019 set out a law stating that normalization surgeries cannot be done on intersex children without their consent. I think the Delhi Commission also brought about in 2022, the Delhi Commission has also brought about a law stating that you cannot do normalization surgeries without the consent of the child. But in our state, we still do not have a law like that. It is still under process. And also, Kerala has a transgender policy which was released in 2015, and it just has statements in it. It says that you need to consider intersex people, you need to give services to intersex people, every kind of services, healthcare included, but then they haven't explicitly stated what all has to be included in it, starting from the birth certificate. So that lack of clarity needs to be revised, which we are in the process of. The Social Justice Department is currently undertaking that work, and they've also tried to reach out to us to help them, revise the policy and make decisions, and also to frame a sturdy protocol for that, a health protocol for that, to revamp the entire form in which services are given to intersex children. Also regarding, in addition to, in continuation to what I just told Mritika, the sexual orientation and gender identity and expression part is always there for them to explore for as long as they want, and it's that allowance that they need. So that dialogue needs to be opened up more often. We had very few representation from intersex population for all the consultative meetings that we were holding, and there was one intersex trans woman. Her name is Vijayaraja Mallika. She's a famous poet in Kerala. So she was the one who first brought about the topic of intersex people, and actually brought it to light that intersex people were a much more marginalized group within the LGBTQIA plus community. So I'll definitely be considering the thoughts that you shared, ma'am, and we are trying to bring about a huge change. Hope it spreads out to every state across India. Thank you.
I feel like there is no one right answer. Every queer person has their own journey. One thing we need to, as educators, take in consideration is that the queer person owns their own coming out journey, right? So if they have come out to you, doesn't necessarily mean they would have, they would be okay with being coming out to the entire class, right? Similarly, if this dilemma of discrimination and inclusivity is a dilemma that they themselves would be facing in the entire process of coming out, what we as educators can do is probably just hold space for them, that no matter if they want to come out or not come out, we see them, we acknowledge them, and in terms of discrimination, we do stand by them, a lot of times not directly outing them, but just making sure you convey that you are strong, how strongly you support the community, giving those sort of affirmations which are maybe not directed at that particular person, but that it is received by them. So I think it's all about creating that environment and giving the ownership of their own journey to them.
Amazing. I won't take much time just to think in terms of gender, sex, and and so on and so forth. Looking at queer people, trans people as messiahs who are going to break this gender binary is not a realistic expectation at all, because we all are, even before we found our queerness, trained as mental health practitioners, trained as development practitioners, researchers, scholars. We all are trained in binaries. We all see the world in binaries in many ways, if not in one way, the other way we do see it in binary. And LGBTQI plus, I would never say actually communities. We all, are from different contexts, backgrounds, identities, and there's no way of becoming one in that sense. There's about a way of how do we remain many and still be, hold each other in kindness and compassion, I think. And the point about breaking the binary, queer people, trans people breaking the binary, we do break the binary, but also in many ways we also add to the binary, I think. It's a constant struggle and negotiation for us also, I think. Trans women, trans men, non-binary people, all of us do it, I think. And in those terms, we all are, when we break the binary, we are the one who breaking out of the prison and outlaws. Essentially because many of you want to stay back in the prison, not because we want to be out of the prison. So if we all want to be out of the prison, there won't be any outlaws here, I think. No matter how cozy up you make your gender binary prison, get your Zomato, Swiggy delivery orders, put a LCD TV in it, AC in it, air purifier in it, it is still a prison, and we all queer people, trans people wanting to get out of because we don't have a choice. We recognize it as a prison. We also want all of us cis siblings to recognize the prison you are in, acknowledge that it for what it is, and see how we can collectively break out of it. So let us not put burden on each other. Let's actually take that collaborative effort how to break out of it, right? Yeah, that's all I think. Thank you, everyone. Thank you.